take care of your brain? One thing we talked about. You need to make sure you're doing what? Please, beautiful.
Taking care of it and making sure you have eat healthy foods and exercise so your body is like has energy.
Here we go. So we're looking at what is your brain made of? Who knows this guy's skull? I'm looking for your hands raised. I have a person calling out, please. Help me out with that, please. Let's go to Kevin. Who is this? Do you think his brain is really this small?
Yeah.
I don't know. It's Homer. It's kind of crazy. Is your brain that small, Kevin? Absolutely not. So we were looking a little bit about, we studied yesterday with our brain props about what our brains are made out of.
Before learning about how to develop a growth mindset, students must first learn about how their brain works. What are its parts? How do those parts work together? And how do those parts change as we learn and grow?
The title is Brain Surgery. We're looking to do some analyzing of our brain. The first thing to write down is that the attention is the brain's most valuable resource. Your attention is the most valuable thing you have as a person. So as a student, what you pay attention to really matters. The things that you put inside your head matter.
Having students understand the crucial importance and value of their attention was one of the main goals of this lesson. To pay attention to what you pay attention to really think about what are the messages you're putting inside your brain. From the people you hang out with, to the movies you watch. What are you filling your mind with, and how do you push and challenge yourself?
The brain is like, well, the first thing I do is I freak out. I'm going to yell, I'm going to push, I'm going to scream, I'm going to tell them it's crazy! Maybe that person realizes they don't want Jenna to laugh at them and they want to understand, how do I change that? The way you change it is by starting to practice
if you have
a
ever changed
different
a bad
habit.
habit or thought about something differently, you have carved a new pathway in you.
So what happens is at first it's not easy. It's not easy changing your habits. But eventually, as you practice it, and if you're Isaiah and it is easy, eventually what happens is you change the way your brain thinks. Which is kind of wild that your brain is changeable. That's called neuroplasticity.
To understand developing a growth mindset, I had my students organize statements that would be either a growth mindset or a fixed mindset. Statements they pulled from a Jello brain.
Cerebellum.
Cerebellum is this little bit, see this little wriggly part? That's the cerebellum. Down here is the cerebrum. And this is, what is this front part called?
Frontal lobe.
Okay, so Kevin, you want to do the first incision?
Ew, you're gonna cut the lobe?
So let's put a slice through here and see if we can't find something. Oh, easy on the brain, easy on the brain. That's, no, the fingers with the grippers. This is brain surgery. Easy does it. Okay, oh, nice. Now, let's open this up and what does it say? I know, told you they lock. Be careful. On your seat, Derek. I can't call on you if you're not ready. So, this first clue says...
It says avoid challenges.
So, what do you think is that going to be a fixed mindset or a growth mindset avoids challenges?
Let me see. Sir, I can't talk right
If you want to move your mask, you can.
It says learn from criticism.
So, if you learn from criticism, is that going to be a fixed or a growth? Who can you call on to answer that for me, please, Treasure? So, if you learn from criticism, that's growth. Can you please write that up there for me, Treasure? Beautiful, and then you can come on up. All right.
No.
Easy on the brain.
Oh.
Okay, a little deeper, maybe.
That is grow.
Oh, I think I see something.
That's
Okay.
grow.
Dr. Kevin, can you get it?
Ew.
Ah! Easy, doctor! The patient needs you! Ah, perfect.
Ew. It's only Jello.
Okay. We have a mystery. Oh, what's it say?
It says threatened by other success.
Okay, so our question is, it's threatened by other success. Kevin, who can you call on to answer that for me, sir?